The Portfolio Committee on Health commenced with its second round of public hearings on the NHI Bill. A committee was established to get written submissions from the public. The Northern Cape is the second province to give input on the bill, and the chairperson of the Portfolio Committee on Health, that's Dr. Sibongiseni Dhlomo, joins us on the line from DR in the Northern Cape. Good afternoon, Doctor, and thank you so much for your time on the SABC News Desk.
Good afternoon, ma'am, and good afternoon to all the SABC news listeners.
Doc, you've said that this bill, I read somewhere, that really speaks to the social conscience and social solidarity of South Africans. Tell us what you mean by that.
Yeah, maybe let me just start by saying, no, we are not in Dar now. We were in Dar yesterday. We are now in Uppington, driving to the last city town of this province, Springbok. The bill seeks to address what is only happening nationally and internationally, to say the sick must be carried by those who are healthy. The rich must really be willing and available to support the poor, and the young must be available and ready to support the old. It's a social solidarity program because in any society, ours included, there will always be people with resources and those without. Now, you need to actually be able to say what then happens to those without resources. Should they perish, or should they be carried along by those who do have resources? That's what we have seen internationally in other countries that have gone this route, and the bill actually talks to that.
Dr. Dhlomo, what kind of response are you receiving from the public on this leg of the hearings? And tell us actually why these hearings are so important at this juncture.
We're getting a mixed reaction, but predominantly people are in support, or actually would want to see this bill becoming law. Others are saying, but this has been talked about for many months. What's happening now? When are you going to wish to see this bill becoming a law sooner than later? We really would have wanted this as of yesterday. Yes, there are people who are raising concerns, but they are sort of intertwined with what they see visibly on the ground to say, but how is this bill going to assist us? Our clinic is overcrowded. We have a shortage of staff. We actually have sometimes shortage of medicines. Some of the things that, as we are glad that as we are in these hearings, the Department of Health in provinces and nationally are there listening to some of these issues that people are raising. Because people are commenting about the bill, wanting it to become a law, but they also are raising their concerns on the health system as currently is in the country.
How were the venues or the locations chosen for the hearings? What informed these choices? And of course, there's been a lot of talk about the bill, Doctor. It's not new, of course. It was tabled in the 5th Parliament already, and we started to engage and talk to members of the public. But how informed at this point would you say people are on the bill, and what can be done to improve on their knowledge?
The venues are chosen. First, it is not the first time Parliament is going to the people, so there is that historical knowledge that is there among the officials and those doing this process ahead of us. But two, we do get in touch with municipalities and leadership there to say we would want to come to Pislika Isas district municipality, and they will guide us with the availability of resources in terms of which halls have got good operation facilities, a bigger capacity that can take 400 people or more. So those are things that, among other things, influence the choices of venues. We would want to say we are coming to Springbok, we're in Kimberley, we're in Dar, and we're in Uppington. Can you choose us venues there where we can have a big meeting? As we were in Kimberley, we're in a city hall, and also in Dar, we're in a town hall. Today, again, the meeting was held in an Uppington Town Hall because those are the venues easily available and ready to take anything between 400 and more people.
This bill, when it was first talked about, stirred up a lot of controversy. What would you say are the thorny issues that remain? Where is the major disagreement on the bill? And how worried should we be about the risk of a brain drain and skilled medical professionals actually potentially leaving the country? And Is it justifiably a justifiable concern at this point that private health professionals will find themselves solely dependent on the NHI fund to be paid or to reimburse themselves?
We don't think that the bill should bring a threat to health professionals to be wanting to leave the country. I mean, but if they do, they will probably have to choose which country they go to, because many countries in the world are going this route. It is a WHO sort of prerogative. The WHO has made this very strongly. You probably recall the former WHO Director General, Dr. Margaret Chan, was all out speaking and getting countries to go this route. So there are many countries that are considering going this way. So it's just not South Africa that is thinking about a universal health coverage. We think every South African, all healthcare professionals have got a role to play. This calls upon solidarity with one another to say, is it possible for me to have these resources and share them with other people? Yes, there are genuine concerns people are raising, which I think the department must also address with government generally, because they are saying, where is the money going to come from? And we are aware of certain. I'm a benefit of a subsidy from government of the money that comes to me, and that makes me a better citizen than the rest of the other people. Why can't that what benefits me benefit the rest of the other people? So there are already some monies here and there that can be identified as the NHI mushrooms to 2026. But those are the issues that people are concerned about, the monies, and they are saying, but other countries that started this process also started without any much resources, but they moved on. But those concerns must be still addressed. Number two, the money hasn't been collected into a collective kitty. How guaranteed is it that there's not going to be any corruption against it? Yes, that is what the minister must address and actually give confidence to South Africans with regards to some of those issues. You can't dismiss issues like those as if they don't exist or they are not actually brought back by things that people observe in the country, in the society, that are coming in from, among other things, Judge Zondo's Commission of Inquiry. So we should actually accept that there is an element of corruption in the country which is being unraveled, and the concerns about any money collected for a genuine cause might end up doing wrong things. Please, Minister, allay our anxiety in terms of that regard.
Doctor, when do the hearings across the country conclude? We just want to understand the process further. Can you attach any sort of time frame for us?
This coming weekend will allow members to take a break, Chairman, go and visit their families. Then on the week of the 15th, 16th, we are doing 3 provinces back to back, Limpopo, KwaZulu-Natal, and the Eastern Cape. We will then have to respect the Parliament rising first week of December, and then we start again middle of January and do inland provinces, Free State, Northwest, and Gauteng. We hope to finish those by January, end of January. The first week of February, we will do Western Cape, and then on the second week of February, the State of the Nation, we then sit in Cape Town to listen to all the submissions that our people are still putting forward until the 29th of November. Now, we are waiting for those written submissions. The process must then push and look into that process to finish probably around May, June, ready to bring all the reports to the Speaker for the matter to be debated in the House, and then from there taken into a law. We hope that we will finish our process as a portfolio committee by May, June.
Dr. Sibongiseni Dhlomo joining us on the line from Uppington in the Northern Cape Province. Thank you so much, Doctor, for your time on the SABC News Desk.